Thanks, guys, for sitting down and talk through all this. Let's go through how we all three got here and introduce yourselves. Carl, go first.
Carl Behne, and I first met Jon back in 2014 in the hospital world. I was a hospital CEO, and Jon, I was lucky enough to hire him as my chief medical officer, and so that really began our relationship of working together in healthcare.
Nathan Koerselman, and I met Jon in MBA class. We both happened to go through executive MBA through the University of Iowa, and started discussing this project, idea, I guess, that Jon had around doing direct primary care in the state of Iowa and doing things differently, and that's how I got introduced to this.
Yep, and I am Dr. Jon Van Der Veer. I am a physician by training, and working with Nate and Carl's been kind of a gift. Like Carl said, started in the hospital world as a chief medical officer when he was a CEO, and then working with Nate in our MBA. Nate always tells the story of I just walked in one day and said, well, I quit my job, and decided we'd launch Exemplar Care, which is now Hy-Vee Health Exemplar Care, and really try to figure out how to do direct primary care. I thought it'd start off with 300-400 lives, call it a career 30-some years later. And Nate always said, if you need anything pro forma-wise, trying to figure out what a business would look like, let him know. Carl and I had always dreamt of how do you change what was the status quo that we were working in the past, and here we are almost 6 years later having this conversation about where we've ended up and how we got here.